Welcome back to our next section, valvular heart disease. Makes you short of breath, doesn't it? Yes. Now let's see. Mitral stenosis. Mitral stenosis. Mitral stenosis. What's the most common cause of mitral stenosis? Would that be? Yes, it is rheumatic fever. Therefore, the mitral stenosis person most of the time is going to be in an imported person. It is going to be in a person who is an immigrant. Why? Because acute rheumatic fever is almost exclusively a non-domestic disease. This is, after all, USMLE, which means that once your per capita income goes up about $5,000, what that means is that your rate of rheumatic fever goes to nothing, tuberculosis to nothing, syphilis in large part to nothing. The best way to help raise the health standards of the world? 1 billion people living on $1 a day. 2.7 billion live on $2 a day. If you could get that to be $5 a day, most of these diseases would cease to exist. If you can get the average, the lowest end of the world income to $5 a day. In other words, rheumatic fever is virtually non-existent here, so mitral stenosis is in imported people. Now, if you don't know why to blame a problem on, but you've got a problem, and you say, I've got a problem, it can't be my fault, who do you blame it on? Parents. Why do we have relationships? In order to have someone to blame. Now, let's see. 2/3 of patients are female. Also, that's a little skewed. Females come to attention for symptoms earlier. Why do females come for attention for symptoms? Because I may be juicy and full of life, but I'm never getting pregnant. No matter how juicy and full of life Dr. Fisher is getting, I'm not getting pregnant. And women who get pregnant, you see that stenotic thing? You're going to look for the pregnant female, because what happens is you have an increase in 50% in plasma volume. And what ends up happening? You have a stenotic orifice. Look at this stenotic orifice. Oh my, what a tiny hole. Oh my, what a tiny hole there is there. Yes. That does look tight. Yes, and this woman has got herself an increase in plasma volume of 50%, but the mitral stenosis hole is staying the same small size, so it doesn't fit too. And that's for the pregnant woman. You've never been so juicy as since you've been pregnant. You've never been so ripe. You've never been so ready to drop like a big fruit. But your mitral valve won't let the fluid through. So what happens to you? You get short of breath. Oh, that's all valvular disease, isn't it now? You get short of breath. That's all valvular disease. You get tired. Well, if blood won't go forward, you get tired. Now, anybody who has a stenotic lesion will have hemoptysis. Aortic stenosis also gives you congestive failure and shortness of breath and hemoptysis. Hemoptysis means you're just coughing and you're a little too juicy. Hemoptysis. Now, embolism. Why do you get an embolism? Well, this is the first thing that we have here, finally, that is unique or more predisposed to in mitral stenosis. Why do we have the greatest amount of embolism? Because we have the largest left atrium. And since we have the largest amount of left atrium, we have the largest amount of AFib. And since we have the largest amount of AFib, we have the largest amount of strokes. So therefore, we have the largest left atrium, the largest amount of AFib, the largest amount of strokes. This is the first thing that's unique for mitral stenosis. What's different? What's unique? I want to answer the question, which of the following is the most likely diagnosis? I want to answer the question, which of the following is the most likely diagnosis? They all make you short of breath. Aortic stenosis makes you short of breath. Mitral regurgitation makes you short of breath. Aortic regurgitation makes you short of breath. What's different? What's unique? What's different? What's unique? Largest amount of left atrium, largest amount of AFib, the largest amount of stroke is a person who has mitral stenosis. What else is different? Hoarseness. Why? Because that big left atrium is pressing on the recurrent laryngeal nerve. That big left atrium is pressing on the recurrent laryngeal nerve. That big left atrium is pressing on the recurrent laryngeal nerve. Okay? big liver, big edema, big heart, shortness of breath. The other thing is you're going to also look for dysphagia because the big left atrium is pressing on the esophagus. This is a lateral chest x-ray, and this is the heart. The heart, the most posterior structure in the heart is the left atrium. As the left atrium enlarges, it enlarges backwards and presses against that esophagus. So that what is different about mitral stenosis from all the others? Hoarseness, AFib, strokes, dysphagia, and also, which of these is in a pregnant chick? Only mitral stenosis. You get your rheumatic fever when you're 10 or 20, 8, 10 years old, and rheumatic heart disease 10 and 20 years later, man. We're just in time for pregnancy. What is different? What is different about mitral stenosis? It has the biggest left atrium, the biggest AFib. RALS is not different. They all have RALS. Decreased pulse pressure? Yeah, whatever. Loud S1. You know why there's a loud S1? Because it's like the door being slammed. You have a stenotic valve, right? And what happens is that the valve normally goes like this, normally flops shut. Normally flops shut. Normally the valve flops shut. Now you get this creaky stenotic valve. It's only halfway shut when the ventricle contracts. Normally it's like this. Lub, contraction, shut, contraction. Now the stenotic valve goes, and it's halfway open when the ventricle contracts. So instead of the valve shutting like this, what happens, the valve is halfway open and the ventricle contracts. Bang! Slam the door, man. Ventricle contracts. Bang! That's a loud S1. That's a loud S1. What's happening is that the ventricle is contracting when the mitral valve is still open, and instead of flop, lub, bang! Loud S1. Opening snap. You see how that's in red? Why, it must be important. It's in red. The opening snap happens because it's the sound of the mitral valve opening. Unique, unique, unique. Unique, unique, unique. Unique, unique, unique. Unique, unique, unique. S1, S1, S2. S1, S1, S2. Well, what happens is that you have a person who has a unique opening in here. Opening snap, you have an opening snap, and then after the opening snap, you have blood squeezing past the stenotic mitral valve. You have blood squeezing past a stenotic mitral valve, and that is mitral stenosis. Blood squeezing past the stenotic mitral valve. Now, as the mitral stenosis gets worsened, does the opening snap happen earlier, or does the opening snap happen later? Does the opening snap happen earlier, or is the opening snap as it gets worsened? The opening snap happens earlier. The opening snap happens earlier. The opening snap happens earlier. Okay? So what happens? Opening snap happens earlier. What's different? Well, if the mitral valve is all stenotic, the left atrium gets large. So what do you see in an EKG? I see left atrial enlargement. Left atrial enlargement. I see left atrial enlargement. Why am I going to see a person who has right ventricular hypertrophy? Because of pulmonary hypertension. Pulmonary hypertension hypertrophies the right ventricle. The chest x-ray, I'm going to see the signs of an enlarged left atrium. I'm going to see the signs of an enlarged left atrium on a chest x-ray. I will see the signs of an enlarged left atrium on a chest x-ray. And the signs of an enlarged left atrium on a chest x-ray, straightening the left heart border. The signs of an enlarged left atrium on a chest x-ray, straightening of the left heart border. A second density can be seen behind the heart. And the left main stem bronchus, can get pushed up. The left main stem bronchus can be pushed up. the left main stem bronchus gets pushed up, straightening of left heart border, double bubble behind that ventricle. So that's the sign of the large left atrium. You see a double bubble. You see straightening the left heart border. You see lifting up the left main stem bronchus. The echocardiogram will show that this thing is thickened and stenotic and thick and a large left atrium and right ventricular hypertrophy. Wow, a medical therapy for mitral stenosis. What medical therapy dissolves out the stenosis? Well, there isn't any. There is no medical therapy to dissolve out stenosis. But there is preload reduction. There is preload reduction, and preload reduction, there is a preload reduction, and there is preload reduction, and preload reduction will at least be sodium restriction and a diuretic. So sodium restriction and diuretic decreases the volume into the lungs. Will ACE inhibitors help mitral stenosis? No, because ACE inhibitors help with ventricular emptying. And this is a problem with ventricular filling. This is a problem with ventricular filling. Okay? This is a problem with ventricular filling, so therefore ACE inhibitors won't help. Will digoxin help with mitral stenosis? No, because digoxin helps with ventricular emptying. Digoxin will only help if there's AFib. So diuretics and salt-restricted diet are the two mainstays of preload reduction. They don't cure the disease, but they keep the volume out. A 27-year-old pregnant woman is developing progressive shortness of breath despite diuretics and salt restriction. I don't like giving a diuretic to pregnant women anyway, because diuretics can cause intrauterine growth retardation. Diuretics can cause intrauterine growth retardation. What will you do next in the management of this patient if the diuretics are being given? Well, I would do balloon valvuloplasty. Okay? Digoxin will only control the rate in AFib, but balloon valvuloplasty, you balloon the mitrals. You balloon the mitrals. You balloon the mitrals. And you surgically replace the aortics. You balloon the mitrals and you replace the aortics. So you balloon the mitrals and you replace the aortics. Now, commiserotomy is what we used to do before we had balloons. Well, why is a balloon better than a commiserotomy? Because a commiserotomy, the commissures, where they attach to each other, you have to open the chest to do it. See, that's a little problem, right? Commiserotomy means I have to crack you open like a lobster, spread your ribs, slice your heart open, make cardiac carpaccio. That's not so good. Balloon valvuloplasty, 20 minutes, in, out, done. Fantastic, fantastic, fantastic. Ready? Balloon valvuloplasty was invented to keep pregnant women out of the operating room. Balloon valvuloplasty was invented to keep pregnant women out of the operating room. And that's what balloon valvuloplasty is for. Now, mitral regurgitation. Regurgitant lesions in general are caused by infections, infarctions, ischemia, anything that makes you dilate. As your heart gets ischemic, does it get more contracted or does it get more dilated? It gets more dilated. It gets more dilated. When you get infarcted, things only dilate. And when you dilate, it only regurgitates. Remember that dilation equals regurgitation. 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 So therefore, when you infarct, when you ischemic, you get dilated. So therefore, these due to abnormalities, that's a cute word, right? Abnormalities means ischemic heart disease. That's what we mean by abnormalities. It's not like, retain negative emotions or loneliness. It means ischemia. Ischemia. Okay? It dilates the left ventricle. Well, what does it mean? Due to abnormalities. It means ischemia. You're dilating. Dilating equals regurgitation. And this word about men greater than women, that's true, but that's cutesy. That's cutesy. That's saying ischemic heart disease is more common in men. Ischemic heart disease is more common in men. So, oh, look at this. That means that things are flowing backwards. That's not good. It's supposed to go the other way around. It's supposed to go from this way to this way. Oh, look at that. Look at that arrow. Let's do that again. Let's see that again. Oh. Oh! I don't know what it is, but it's going the wrong way and it's big. That's called regurgitation. And it dilates. It dilates the atrium when it regurgitates. Oh, look at those arrows dilating me up, man. Let's see those arrows dilating again. Oh, this is so much fun. It will all become clear.